Who else is immune compromised? Anybody on steroids, right? The elderly,
A baby,
The very young.
babies, the very young, the very old, and who else?
People with autoimmune disorders.
People with autoimmune disorders,
Immunosuppressants.
right? Immunosuppressants, and who else? Diabetics, anybody like that, and who else?
Children.
Pregnant people, okay? Pregnant people are immune compromised. So if we have clients who are the very old, the very young, pregnant, any sort of underlying disease process, any autoimmune disease, cancer therapy, transplants, those people are all immune compromised and they are at risk for pneumonia. And then we have aspiration pneumonia. What is aspiration pneumonia? Right, and how do we get that? You can get it when you have an NG tube. You can get it when you have a tube feeding that's come dislodged. You can get it if you vomit during anesthesia. That's why it's so important to keep your clients NPO. Yes, Jessica.
My best friend's son got it from drinking Torch fluid.
It's drinking.
He thought it was a bottle of Gatorade and they had not tightened his top.
Did he die?
No. He had a nice little trip and an ambulance to the hospital, and when he realized that it wasn't Gatorade and tried to spit it out, and then he inhaled it and had aspiration pneumonia.
Wow.
Yeah.
Wow.
Yeah.
So that's one of those things we do for a little aside to keep our children safe, isn't it? We don't store anything in a fruit bottle.
Well, it looks like Gatorade.
Well, yeah, it's pretty scary. So when we're talking about aspiration pneumonia, we're talking about breathing things in. So if you have someone who aspirates just about anything, they can get pneumonia. We see it in neonates if they aspirate meconium. Okay, aspiration of gastric contents. If someone starts to vomit and they're only minimally conscious, and they can aspirate. So if someone is only minimally conscious and they begin to vomit, what do we do? When we position them, turn them on their side. Okay, turn them on their side. So those are basically the four types of pneumonia. Now, which of those types of pneumonia are caused by microorganisms?
community-acquired and hospital. And all of them except for aspiration.
Aspiration pneumonia is not, okay? You can get a secondary infection, but aspiration pneumonia is caused by an inflammation of all those tissues. Pneumonia, and also can be caused by viral. You know, as far as infectious agents, we're looking at bacteria and viral, and a few fungi, and some really sick folks. So how are we going to diagnose? We're going to diagnose it by chest x-ray. There's a certain feel, a way that it looks. Pneumonia looks on x-ray. And we're going to do a sputum examination. But if someone comes in with a high fever and a productive cough, we're going to presume they have pneumonia, and they're going to be administered antibiotics, but cultures will be done first. We'll probably do blood cultures first and get sputum cultures as soon as we can. Yes, ma'am?
Sorry, could you said about how it's caused in the book, I guess I'm just not following it. It says under the aspiration pneumonia that it can occur when you breathe in the S. pneumoniae and influenza and aureus, but then it says also occurs when you aspirate vomit. So
I'll have to look at the book with you later because I'm not really sure I understand your question. You can get pneumonia from an infectious agent, but you can also get aspiration pneumonia independent of any infectious agent.
Yeah, I was going back to the part where you were talking about which ones were caused by infectious agents.
Microorganisms. Aspiration pneumonia is not caused by an infectious agent. Okay, as a typical, now if you're thinking about Legionnaire's disease, but we're talking about aspiration pneumonia independent from infectious pneumonia. And if we'll talk about it more later, you and I, okay? So let's talk about medical treatment of pneumonia. Oh, I'm sorry, let's back up to diagnostic tests. We look at chest x-rays and we also look at sputum evaluation. How do you collect a sputum specimen? Rinse the mouth out, right? Okay, because you want to get rid of the oral microorganisms. If if we can, as much as possible. Yes?
And you said blood culture too, right?
We do a blood culture when they first come in.
Okay.
That's not on that piece of paper. Not on that slide, excuse me. Definitively, to figure out what's going on though, we want to go ahead and, we're going to treat them with a broad spectrum antibiotic when they come in. Even though it may be viral, we're not sure. If someone comes in with a high fever and a bad cough and sputum production, we're going to treat them for pneumonia. Okay, we're not going to say, oh, I wonder if it's viral, and wait 48 hours. We're going to treat them within 4 hours. If you have someone who comes in with what you believe pneumonia, within 4 hours you need to have an antibiotic on board. Okay, it's a diagnosis of exclusion. Right now, we think it's some sort of horrible thing that is resistant to everything, and we're going to give you a broad spectrum antibiotic like a 4th generation cephalosporin. Okay, we're going to treat you with that. We're going to do blood cultures. We're going to treat you with that. We're going to make sure that we support your oxygen. We're going to check your oxygenation. Support oxygenation. We're going to support your fluids. We're going to support whatever system we need to support while we're figuring out what's going on with you. When you first come into the emergency room with a fever of 104 and sputum production, we're going to presume you have pneumonia. And within 4 hours, Joint Commission says we need to have an antibiotic on board, a broad spectrum antibiotic. Blood culture's done, IV started, broad spectrum antibiotic. Okay? When we're diagnosing you to figure out what else is going on, we're going to do a chest x-ray, see what your chest looks like, and we're going to get a sputum specimen as soon as we can. And so your job as a nurse is to collect the sputum specimen. Okay? In addition to these other things. Medically, we're going to give them fluids. We're going to give them oxygen for hypoxia. We're going to give them antipyretics, which treat what? Fever. We're going to give them antitussives, which treat what?
Cough.
And what do they do? How do they treat cough? We give them expectorants. They also suppress cough or they clear mucus, okay? Decongestants, so that they're not so congested, so the bronchioles are open, so their gas exchange can at least get down that far. And antihistamines. So what do antihistamines do? Right, and they also they reduce inflammation, right? They stabilize mast cells. So we'll get a gram stain as soon as we can. But until we have a gram stain, we're going to give them a broad spectrum antibiotic.
The
Yes?
antibiotics that are given until we find out what exactly it is, so we give the actual antibiotics that they need.
Right.
Would that ever backfire, like give them something that you weren't supposed to and made it worse?
Not typically with pneumonia, but you may not be able to treat what you're doing. If you give them a broad spectrum that treats gram-negative and gram-positive, aerobes and anaerobes, and there are antibiotics like that out there, then it's not likely to backfire unless they have something allergic. Okay? But now, if you have someone who's got kidney disease and you give them a 4th generation cephalosporin, you can shut their kidneys down. So backfire from that standpoint, I suppose. When you have someone who's coming in with a fever of 104, and they're hypoxic, and they've got sputum production, I put them on respiratory isolation too, but generally.
Because that was one of my questions when I went to the doctor. They didn't know what it was yet, and they were already giving me antibiotics. I'm like, but if you don't know what it is, how are you going to treat it?
Because they're treating with the broad spectrum, because they can't wait. Are they going to let you die? No, death is not a good thing, and getting worse is not good. Yes, Angela.
When you find out that it's viral, do you stop the antibiotic?
Sometimes, yeah. Yeah, they'll stop the antibiotic if they're sure it's viral. But basically, you're going to, if you don't know what's causing it, you're going to treat them empirically. You're going to presume it's the worst thing you can have. And you're going to give them a broad spectrum antibiotic that's effective against gram-negative and gram-positive organisms. And if your antibiotic is not effective against aerobes and anaerobes, you're going to give them something that's effective against both.
What's some broad spectrum antibiotics?
Cephalosporin, there's one right there.
Besides,
There are lots of them out there. Some of the flagyls. But we'll get into those later. Right now, though, usually we